Now I want to talk about narcolepsy. And narcolepsy is a disorder that has been really misunderstood over a long period of time. What exactly is narcolepsy? Narcolepsy is a disorder of excessive sleepiness, but I don't look at it as just a disorder of excessive sleepiness. To understand narcolepsy, you can't just read a definition from somewhere. You have to understand what's going on in normal sleep, normal daytime as well. So let's take a number of steps back. So very early, we showed what normal sleep is during the evening. And one of the things that we showed was our REM sleep. And we mentioned a couple things about REM sleep, rapid eye movement sleep, our dream sleep. And indeed, just that, number one, you are dreaming, but number two, our muscle tone is low, almost as if we're paralyzed. And that is protective, so as we're sleeping, we don't actually act out our dreams. Now, another key thing that we said is that our first REM period, our first dream period, actually normally doesn't come until after an hour of sleep, about 90 to 120 minutes. So now the way that we evaluate for narcolepsy is we do a sleep study first and make sure that there's not something obvious that's causing some daytime sleepiness. Now, if we didn't find a particular reason to have the sleepiness, then many times the next day we go on and we do an MSLT, or a multiple sleep latency test. The name isn't important. The concept is that we have someone take 5 naps. Now, if they don't nap, and some people may say, well, how are you going to nap in 5 naps? And if you say that, then you probably don't have a disorder of sleepiness. But the concept is that we can objectively measure this. We know what parameters are normal. It is 5 multiple naps, sleep. How long does it take to get to sleep? Latency. And we have normal parameters. We have normative data. Test, MSLT. Now, coming back to what we mentioned in regards to REM sleep, that you normally don't get your first REM period until after an hour of sleep, until after about 90 to 120 minutes. Now, if we're taking a 20-minute nap, should you see REM in that 20-minute nap? No. And that would be pretty fast. That would be sudden, as a matter of fact. And it would be sudden onset of that REM period. And that's one of the things that we do to look for narcolepsy, is we look at the SOREMs, sudden onset REM periods. And in a patient with narcolepsy, they may have 2 or more of these sudden onset REM periods. And the parameters that we use is that if someone is falling asleep within an average of 8 minutes and they have 2 or more of these sudden onset REM periods, and there's not an obvious sleep disorder overnight that's causing this, that's enough for the diagnosis of narcolepsy. So now that we talk about the way that we diagnose narcolepsy, and we talked about normal sleep and REM, now we can actually understand the symptoms a little bit better. And indeed, you can have sleepiness that's coming into our daytime. Another thing that's important to know is that there's narcolepsy with cataplexy, and then there's narcolepsy without cataplexy. So not everybody has all of the symptoms. Some of the other symptoms that are now going to make a little bit better sense to us. Again, the sleepiness, but we can also have cataplexy. Again, remember, in REM, our muscle tone is low, almost like a paralysis, and cataplexy is the intrusion of that low muscle tone that comes into our daytime. And it can be as profound as passing out, or it can be as subtle as muscle tone that may come down, your jaw may come down, difficulty verbalizing, difficulty speaking during a stressful period. Again, we have these hypnagogic or hypnopompic hallucinations. It's a dream while you're awake. You can see literal, vivid images. Now, in evaluating demographics and taking a look at the different age ranges, the most common age range that we see these symptoms of narcolepsy start to come out is actually 15 to 19 years of age. And the second most highest is actually from 10 to 14 years of age. Narcolepsy has some comorbidities that are really important. 25% of the patients with narcolepsy also can have sleep apnea. And actually, I've been told that that estimation is low, that it's more 25 to 50%. Also, insomnia is a very common complaint in narcolepsy. About 50% of patients with narcolepsy also can complain of insomnia as well. The biggest difficulty that I have sometimes treating narcolepsy actually isn't the medications themselves, but it's the family support. And understanding normal sleep is actually what helps in understanding the diagnosis, evaluation, and the treatments in narcolepsy.